Alright, so we'll try to work on the next terminology. We get to talk about what this terminology is, and if you see it in orthopedic, what does it mean? So we get to talk about the term known as what? Metastatic disease. Sorry, metastatic infection. Metastatic infection. Alright, so when you're talking about metastatic infection, what does it mean? Alright, so metastatic infection, just so you know, it generally refers to what? Infection that spread from its original site to organs that are far away. Okay, and it does that through the bloodstream or through the lymphatic system. You know. So what are the key features? The key features of a metastatic infection is you have an infection somewhere. Do you understand? So okay, there's a secondary infection occurring at a site which is far from the primary what infection. So mechanism, you could have bacteria, you can have fungi, you can have viruses. So they usually enter the bloodstream and they spread and enter other organs. That's why we now say an infection is metastatic. So common sources could be that there's an infection in the skin, it tracked into the body. There could be infections in the mouth, tracked into the body. There could be infections in the urinary system, tracked into the blood body. Pneumonia, infected intravenous lines. So examples: endocarditis, where there's infection of heart valves, often seed from oral or skin bacteria. Septic arthritis, the bacteria will now spread to the joints. Brain abscess, it can spread from the sinus, ear, dental infections. Osteomyelitis, where bone infection will now seed from the bloodstream. We can also have metastatic abscess, okay, where there's like a lot of abscess in a lot of organs. So the general symptoms will be symptoms that are related to like the organ which is affected. You have different symptoms when the liver is affected, different symptoms when the pancreas is affected, different symptoms when the lungs is affected. But in general, you have fever and chills. Then also pain in that organ. The person is weak, is feeling unwell, the person is losing weight because they are not eating very well. So organ specific changes is depends on the organ that is affected. So treatment is antibiotics if you are dealing with bacteria, antifungals if you are dealing with fungi. You drain the abscess. You give the person fluid, also pain management and keep monitoring the organ function.